for our lifestyle medicine update for the month of May, what we're looking at is multiple different studies, including a simple one that looks at long-term effects of COVID on the heart. And what we're seeing is that COVID can lead to diastolic dysfunction in the heart, where the people will have a blood pressure, second number, the diastolic, that won't come down as much because the heart can't relax, meaning eventually the heart is made to work too hard. So even though COVID is over for now, its long-term effects are being seen in people. We have another study that looks at physical therapists and pain. This is a group called the Doctorate of Physical Therapy, which is essentially just therapy again, but they report that they're having more pain. And they're not really comparing anything, they're just reporting that they have increased pain. Many allied health sciences will be labor-oriented. And because they're labor-oriented, there's going to be a lot of mechanical strain involved. So it's no real surprise. What would be interesting is to compare this to a different population, like a nurse or an actual doctor, like a physician or a surgeon, and see what the difference is. Another one we have is Polycystic Ovarian syndrome and Metabolic syndrome. Do these two link together? So they look at the data from 2,172 females from a basic database, and they say these two things overlap quite well. Now the question again is, why are these people having metabolic syndrome? It's essentially going to be a very high carbohydrate diet, high fat diet, right? And then that leads to excessive weight gain and hormonal imbalances. But these people did have increased triglycerides, decreased LDL, increased latent testosterone, increased sex hormone binding globulin. They all had OCP use, etc. So all these come into play when you look at these kind of factors. A really kind of strange study from China comes and shows that folic acid supplementation increases the chance of lung cancer. This was done in 27,631 people, and they find that for some reason those who are taking this folate supplement will have more lung cancer. Now, why it's happening is not really clear. Is it really the folate that's responsible? Is it the adjuvants that it's bound to in the supplementation form? We don't know, but this is happening. It would be interesting to see this happen in other populations, or if it's a brand issue that people are consuming and having. Another study looks at forever proteins, PFAS, and they've looked at 6 different types of PFAS in relation to pregnant women, and then how their heart performs during the pregnancy. And what they see is that when women are screened for PFAS from samples through their trimesters, those who have higher PFAS consumption, forever plastics, they're going to have worse cardiac parameters, and these are people who go into stress during pregnancy. So it's really, really important to look into these kinds of things. Forever plastics are found in all the basic things that we use nowadays. So if you're eating from food heated in plastic, this is a problem. Another kind of common sense study that has come out is the body roundness index, and it's linked to obstructive sleep apnea. Body roundness meaning central fat and then visceral fat. So it's no surprise that OSA is strongly linked to it, but it's a simple measure we can do to see if a person is at risk. And then the question becomes, so what? How do you use it in clinics? But if you have a person who is having memory impairments, impulsivity, and they're overweight, you could look into sleep apnea to see if there's a problem, because if they live alone, they may not know that they're having this issue. Along the lines of sleep, we have another study that looks at inflammatory markers after sepsis and its relation to sleep. And it kind of makes sense that the higher the inflammatory markers are, the more poor the sleep is going to be, and vice versa. Along the same lines with sleep, again, what we're looking at is a different study that looks at resilience, or the ability to bounce back, and how it relates to trauma and fracture. Now, they find that people who don't sleep as well don't have that good resilience, which is kind of common sense, because sleep is when we heal all that we've gone through in the day. So if a person isn't sleeping well, this is what you can expect. What does it mean, though? it means we could look into why they're not sleeping. And many times the most common thing is going to be the culprit in front of us, the screen that we're staring at. If it has a high contrast compared to that peripheral environment where you're in a bright screen in a dark room, these things can overstimulate the brain. That can mess up the suprachiasmatic nucleus that is responsible for regulating your circadian rhythm, and that can lead to higher stress, poor healing, less resilience. The last thing we're talking about today is the harmful effects of high-fat diets versus a low-fat dairy diet. So what they're finding is that high-fat diets lead to more and more cardiac problems in the high-fat dairy diet. That is our summary for lifestyle medicine for this month.